Hello and welcome to the demonstration video for Junior Doctors Rotation Session 1.
Hi everyone, welcome to a quick overview of the Doctors Rotation training. Right, let's have a look at how to change your PIN in Meditech. Click on Physician Care Manager, sometimes referred to as PCM, then go down to Preferences. You change PIN number buttons at the bottom of the screen. Enter your Windows password. Create a new PIN number. Verify the PIN number and then click OK. Click the Save button to update your PIN number. We're now going to have a look at the function buttons. At the bottom right-hand side of the screen, you will see a question mark. This will open the basic Meditech help screens, which will provide you with information about the screen you're on, but will not show you how to complete the screen. The globe icon provides you with links to various websites and documents, including the AKI bundle checklist, which is available for printing if there are none available on the ward. You can also see links to Meditech e-learning and the Meditech training guides. Our Meditech e-learning is available internally on the hub or externally via the link you have been sent. Please ensure you complete all relevant e-learning, session assessments, evaluations and the EPMA assessment. One of the first things you will need to do when accessing Meditech will be to build cover so that you can see any abnormal or critical radiology or lab results that you have requested, as these results are directed to the consultant that the patient has been admitted under on the ward. Other results will be available in the patient record. You can build cover for individual consultants, by location or clinician teams. Building cover for clinicians' teams will display all patients under a specialty rather than under an individual consultant. You will need to build cover for inpatients and outpatients separately. Once you've built cover, you'll then be able to see any abnormal or critical radiology or lab results that you have requested. To see these results, click on the plus button at the side of the results and click on the patient's name. If you want to look at the textual report, you can click on the report icon. You must also complete the Report Results Action Taken document for any abnormal or critical results that you do view. And to do this, click on the Document button on the right-hand side of the screen. Click on the New button and then select the Report Results Action Taken document. Action the document. Once you've completed the Report Results Action Taken document, you need to acknowledge the result. And to do this, you need to click on My Notices and click on the Acknowledge button at the bottom of the screen. And if you look up here in the status column, you can now see that the status has changed to acknowledged. To find an individual patient on Meditech, you'd click on the Find Patient button on the right-hand side of the screen. And using the Trust Standard Operating Procedure for patient searching, you'd search for your patient using either the NHS number, the medical record number, otherwise known as the RU number, the patient's date of birth, the partial name, or the full name. But remember, if you do have to use the patient's name, then you have to type in the surname, comma first name with no spaces. The preferred method of searching is using the rounds list, which is accessed via patient lists. Once you've built cover, this will then display all the patients for the consultant, location, or clinician team that you've built cover for. On the rounds list, you will be able to see any orders that have been placed, the reason for the patient's admission, and any tasks and documents that have been completed. From within the rounds list, you can make sure that you highlight your patient and click on the Open Chart button to the left of the patient's name, and this will take you into the electronic record of the patient. We're now going to have a look at some of the initial documentation that will need completing when a patient is admitted to the hospital. So to do this, click on the Document button, click on New. You can click on the Word document at the top of this section, and this will put all the documents in alphabetical order. And the first document that you need to be completing is the inpatient admission summary. Now, the information that you enter in this document will populate various other documents and also the rounds list, thus saving you lots of time. Make sure that you also complete the VTE assessment section, and this will need completing within 4 hours of a patient being admitted. Make sure that you complete all the mandatory fields, as this will prevent you from saving the document. On the first consultant-led ward round, you'd need to complete the post-take inpatient ward round note. And again, information added via the admission summary will populate some of the information in this document, but it can also be amended or updated appropriately. You would then complete the inpatient ward round note on any subsequent ward rounds. From within the patient record, you can order any tests or investigations. For inpatients, this is undertaken from the Orders button on the bottom right-hand side of the screen. Please note you won't be able to place any orders if the allergy and adverse reaction hasn't been recorded for the patient. Before placing your orders, you can view any current or historical orders. However, before we carry on and place any orders, I just want to talk to you about some datixers. So there's been incidents in the past when orders have been placed for the wrong patient. This has then resulted in patients undergoing tests or investigations that they did not require. Please make sure before ordering any tests or investigations that you have the correct patient and visit selected. We're now going to look at placing an order for a full blood count and an X-ray. So to do this, you'd click on the New Order button. You won't have any favourites set up at this point. However, you can add these later by watching our Meditech e-learning. Click on the Name button. And then Again, this is your own preference. You can either click on Starts With or Any Word. You'll find your own preferences once you've started using Meditech. But for training today, we're going to use Any Word. And by choosing Any Word, what will happen is as you start to type in the order, so for example, the full blood count, Meditech will try to help you by displaying the test with the combination of letters that you've typed. Tick the box to the left to queue this order up. And then what you would do is repeat the process to place a chest X-ray. So you'd click back in the order data field, type in chest, and select the XR chest option. And as you can see, we've got 2 orders queued up now. But remember, we haven't ordered them yet. These are merely queued up. So to continue to place the order, you now need to click on the next button at the bottom of the screen. Rather than editing each individual test, you're going to click the Edit All button at the bottom of the screen. And on the Manage Order list, you'll be able to see the orders that you've ordered queued in the list. By default, the specimen data field is set to Nurse Care Clinician to collect. However, if you're going to take the test yourself, then you will need to change this to Has Been Collected, which when saved will print off your lab labels. Enter some clinical details. If you've completed the VTE section of the admission summary, the VTE data field will not be mandatory. If the test is urgent, then you would need to add a red urgent sticker to the sample bag, as labs don't use Meditech and they will not see that you've marked the test as urgent. Now that we've filled in all the information for the full blood count, we need to do the same for the chest X-ray. So click back on the chest X-ray, click in the clinical details data field, type in some clinical details. Again, like with any other document, all the mandatory fields do need to be filled in. So the patient mobility and the contact number /bleep data field need to be filled in. However, radiology orders can be marked as urgent and will be picked up by the X-ray department. Once you've filled in all the appropriate data fields, click Submit. Pop in your Meditech PIN number and click Save Selected. You'll be returned to the order screen and you can see that the chest X-ray and the full blood count have now been ordered. You can also use order sets rather than placing individual orders. So what you do is make sure you clicked on New Sets, and in the order set data field, for example, type in chest pain. Put a tick in the box at the side of the chest pain you wanted. Click on the next button. And what it does is it pre-selects all the tests that are relevant for chest pain. However, you can just untick the ones that you don't want to order. And then continue to place the orders as previously done by clicking the Edit All button at the bottom of the screen. You can cancel any tests that have been ordered or collected by changing the status to stop. Select a reason for stopping the test. Click the OK button. Click Submit. Enter your Meditech PIN number and click Save Selected. And you can see now that the order's been stopped. Any specimens that have been sent to labs, you need to also telephone laboratory to make them aware that it's been cancelled, and do exactly the same for radiology. The departments must be contacted by telephone and informed that they've been cancelled. If you later decide that you need to collect the specimen yourself, then you'd return to the order screen and you'd click on the Edit Multiple button at the bottom of the screen. Put a tick in the box at the side of the test that's in a status of uncollected and click on the Collect Specimen button at the bottom of the screen. Click on the Today option from the Collection Date data field, and in the Collection Time data field, click on Clock and select Now. Click OK on the right hand side of the screen. Click Submit. Pop in your Meditech PIN number and click Save Selected. If for any reason your labels don't print out, you can reprint them from the Patient Reprint Routines option on your Meditech menu. Select the Reprint Lab Labels option. Type in your patient's name, and don't forget it's surname, first name with no spaces. Press the Enter button on your keyboard. Cancel the following screen. Select the ADM in admission, and then make sure that you select the correct specimen that you want to reprint the labels for. You'd repeat if you wanted to do it for multiple lab labels reprinting. Click OK, and then you'd follow the on-screen instructions to select the printer that you want the labels to print to. We're now going to look at electronic prescribing, otherwise known as EPMA. Pharmacy staff will usually have entered any home medications that a patient has brought into hospital with them or that they're currently taking. However, if this has not been undertaken, then it would fall for a clinician to do. From within the patient's record, ensure you're on the summary screen and then click on the blue Edit button in the Home Medication section. If the patient's had any previous admissions and any previous home meds or TTOs have been recorded, these can be made active for this current visit. To add a new home medication, click on the New button at the top of the screen and then click on the Name button. Search for the medication that the patient says that they're taking, so we'll say paracetamol. And you can see that a list of all the different formularies will be displayed. Click on the plus button at the side of the appropriate medication. Again, click on the plus button again, and then select the dose that the patient tells you that they're taking. What you then need to do is enter a source of the information. So we'll choose patient for this. And then we also need to say when it was last taken. And in this instance, the patient said they last took paracetamol yesterday. So we're going to say it was 1 day ago. And that's it. Click the Save button. And that's the paracetamol now added to the patient's home medication section. Just a point to note, you can also add home meds through the admission summary as well. Home medications can be reconciled into inpatient medication via the order screen using the Reconcile button. And this will then allow staff to be able to administer the medication. We're now going to look at prescribing inpatient medication. And again, this is done from within the patient's record and from the order screen. Any currently prescribed medication will be displayed on screen. To order new medication, click on the New Meds button and then click on Name. As you start to type in your medication, and we'll select allopurinol, a list of options will start to display. Put a tick in the box at the side of the formulary for the medication you require. And again, once you've done that, just like when we order tests, that medication will be queued up at the top of the screen. You'd repeat the process for any other medication you require before clicking onto your next button. If you've picked a formulary, then the dose, the route, the frequency and the schedule should be complete. However, you can amend these if necessary. So we're just going to go in and have a look at one of the formularies now. We're going to click on the 300 mg oral BD tab. And we're going to click on the Edit All button at the bottom of the screen. So if you did want to make any amendments to this at all, you may want to change the schedule. So you can see you've got the option to select 1 for one-off medication, PRN for as needed, SCH, which is just your routine medication, and your STAT, which is your urgent medication. You can also add a start date and time to the medication if you don't want it to start today or you wanted it to start at a particular time. If the medication is for a TTO, then you'd click in the TTO data field and select yes. You can put in a number of days to supply the medication. Or if it's a controlled drug, then you would need to enter the take-home quantity. You can also select protocols or tapers if needed. Again, once all mandatory fields have been completed, click on the Submit button and enter your Meditech PIN number. Just like with orders, you can stop medication via the status column, as well as putting any medication on hold or resuming. An important thing to remember is when your patient's discharged and they're taking medication home with them, you need to complete a TTO review. So click on the TTO review button. Make sure that you review all the medication on that screen, and once you're happy with it, click on the Review Complete button. Now that you can see the TTO Review Complete message at the top of the screen, you now know that the TTO review is complete and that this will now get electronically sent to pharmacy. Don't forget that at the end of this session, a member of the EPMA team will be attending to answer any questions that you've got on EPMA. We're now going to have a look at some documents that you may need to fill in for the patients that are admitted onto your ward. We've already mentioned the admission summary and the post-take and ward round note, but there are other documents that are available. So if you click on the document button on the right-hand side of the screen and click on the new button, we've got the inpatient communication note, which records what was or wasn't said in a conversation with a patient or a family member. We've got the inpatient general note, which is used for passing information to colleagues about the patient. We've got the dementia and delirium screening document. We've got the inpatient discharge summary, which will need completing when the patient's going to be discharged. Just be careful with this though, because there are some specialty specific discharge documents as well. There's also the mortality stage 1 and mortality stage 2 review documents. Incorrect documents need marking in error. In most cases, this can be as simple as adding text of incorrectly signed documents and a reason. However, there are some documents which will allow you to add an addendum if you miss something off, or mark the whole document in error if it's been completed on the wrong patient. Right, let's have a look where you can go to look at rounds handover information. So from within the patient's record, click on Clinical Panels and then select the Doctor's Ward Rounds / Handovers option. This will display all the patient's latest observations, the medications, and any documentation that's completed. You can also click on any of the report icons to access the various documents and reports. We'll now move on and have a look at the ED tracker. If you need to go to ED to see a patient, you'll need to go to the ED tracker. So you'd go back to your main Meditech menu and click on the EDM tracker option. You'd then select the ED tracker, and this will then show you all the patients in ED at the present time. Find your patient and you can click on the quick link column where you can view patient care, orders and documentation. And if you do click on any of these options, they'll always take you to the specific section in the patient's record. As a minimum, you'll need to complete the ED specialty note. So you'd click on the document / write note option and click on the ED specialty note. You would then need to click on the Add Section button at the bottom of the screen and then select your specialty. Just so that you're aware, we've only had a few put in train, so in live there will be a lot more options. If the patient needs to be discharged, then you'd complete the EDGP letter. Again, just make sure you complete all the mandatory fields and all the sections at the top of the page. And then once you've done that, you'll need to discharge the patient from the ED tracker. Click on the discharge button on the right-hand side. Make sure you clicked on the discharge data button at the top of the screen, and make sure that you complete the discharge date and time and the discharge destination data fields at the bottom of the screen. The patient's GP record is also available through the external data button, provided the patient has a Rotherham GP. You'll see the external data button at the bottom of the summary screen. Click on the GP Detailed Care Record option, and you'll be asked to confirm that the patient's given consent to be able to access their GP record. You can also open Sepia from within the external data button, as well as having a separate shortcut on your desktop. Sepia will display GP information as well as a more detailed overview of the patient record. Just remember that Sepia is only a viewing tool.
You've also got the National Care Record Service available to you via your smart card access. So from your desktop, you'd click on the NHS Spine portal icon, and then you'd select Launch National Care Record Service option here. Wait for it to authenticate and confirm and continue to find a patient. In the NHS number data field, you would type in the NHS number of the patient and select Find a Patient. If there are any type of alerts or reasonable adjustments present, then at the top here, you'll see these amber boxes. You can click on the amber boxes and it will load up that particular information. You can go back to the patient information, and on the clinical tab, this is where you'll be able to see all the GP clinical information.
You can also view your patient's records on your mobile phone by signing in to the Trust mobile rounding tool. Again, you will use your Windows username and password to log in. You can also sign documents via this tool.
For Meditech Junior Doctors Rotation Session 1. If you do need any further information or help, please contact us via email at rgh-it.training@nhs.net, or you can call us on 01709 427 970 or internal extension 7970. Thank you.